Putting sir.
You did not practice medicine after taking MBBS?
Yes, sir. I did not practice MBBS.
And you do not go for any master's or diploma course also?
Yes, sir. I did not go for it.
Because you wanted civil services?
Yes, sir.
But why you wanted civil services?
Sir, I wanted to make a transition from a individual healthcare provider to a much bigger role. So in this sense, civil services provide me with that opportunity and diversity, which also helps me to challenge me at various levels. So I can go for personal improvement as well, sir.
I didn't understand your terms, individual health provider. What do you mean by that?
Sir, during my MBBS, I realized that healthcare delivery does not only include individual curative treatment, which the doctors usually give. It also encompasses within it factors like policy formation, public awareness.
You mean all doctors are only individual care providers? What about Dr. Pratap Reddy? What about Dr. Trehan? What about Dr. Ashok Seth? They built up a big institution and then they are providing it in a big way. It's not that they are only seeing patient and going. So you conceive of medical profession as one doctor and one patient. It can be scaled up.
Yes, sir. It can be scaled up, sir.
So I gave you 3-4 examples. There are dozens of examples are there. Why you can't become another Dr. Trehan and build up a big infrastructure in the country? Is it not contributing to the health sector? Only by being a health secretary you can contribute. Then what will happen to Dr. Trehan's and Ashok Seth and Dr. Pratap Reddy's?
Sir, I believe that even they started from first individual patient care.
Yeah, that all has to start like that.
Yes, sir.
But you can reach the top also. Don't say that you will end up just being an individual health provider.
Yes, sir.
Yeah. Of course, I buy your argument that you can be part of the policy making in health and all that. But then the next question is that you are not supposed to be given health portfolio all the time. You may not be given a health portfolio.
You may never get it.
You may not get it. You may not get it.
Yes, sir.
You might get irrigation, you might get food, you can't get subsidies, all kinds of things you will get. So how will you fulfill this dream?
Sir, actually, I'm counting on that. If I can use my experience and
it doesn't happen like that in bureaucracy. That is a very kind of imaginary situation. Anyway, so I've countered you on 2 points: that individual health provider, and second is that you will do well in health sector. But there is no guarantee you will solve the health sector at all.
yes.
Yeah. Anyway, medical science was your subject also in IAS also.
Yes, sir.
Medical science. All right. What are the latest discoveries on the front of medical sciences to fight some, life-threatening diseases, let's say cancer or let's say AIDS or something like that? You keep abreast of that?
Yes, sir. So the most recent positive news that we heard from the new discovery is the discovery of CAR T-cell therapy, sir. In last week only, we got the first commercial success of the NextCAR-19, that is the indigenous developed CAR cell therapy.
Which kind of cancer it will treat? All?
Sir, it is primarily focused on the blood leukemias, blood cancer, sir, and the patient that was treated was also suffering from blood cancer, sir. So it can be modified in future to fight solid tumors as well, sir. But right now, presently, it is working mostly in the blood cancer, sir.
I was reading the other day that prostate cancer is now becoming more fashionable among the youth of India also, and especially those people who are metropolitan based and all. Earlier, prostate cancer was the disease of the old.
Yes, sir.
Prostate cancer.
Yes, sir.
Are you getting me?
Yes, sir.
So, what according to you could be the reason that it's now spreading among the young and youth?
Sir, I believe like any cancer, prostate cancer also has environmental causative factors, sir. With increasing pollution, with increasing number of people who are having a poor lifestyle or unhealthy lifestyle, the youth who is consuming more and more quantities of alcohol and drugs is exposed to more number of carcinogens as compared to earlier times, sir. So that might be one of the reasons why the cancers which we have commonly seen in the old age are now commonly seen in the younger population as well, sir.
Mm-hmm. All right. Have you ever cared to read about the blue zones in the world? That blue zones have been identified. What do you understand by the term blue zones?
Sir, I am not entirely sure, but I believe they refer to the areas, specific areas in the oceans where there is high, is presenting more focus on conservation of those areas.
So, good news about longevity. There are some areas, 5 areas in the world where people are known to live 100 years, 90 years, and all that. So, there are certain factors. You do not know.
Sorry, sir, I was not aware about
That's
it.
perfectly alright, no problem. You come from Bhopal.
Yes, sir.
You did your schooling also from Bhopal. AIMS
Yes,
also
sir.
from Bhopal.
Yes, sir.
Your father is in Bhel.
Yes, sir.
He is a general manager, right? So, he is an engineer.
Yes, sir. My father is an engineer, sir. He also did his graduation from Manit, Bhopal, sir.
And your mother is a doctor.
Yes, sir. My mother.
So, what is her specialization?
Sir, she is a pediatrician, sir. Child specialist.
So, even she could not impel you to stay back in medicine. Did she not argue that son be in medicine only?
Sir, she was the reason I joined medical in the first place, sir.
She was the reason, okay.
But, sir, I believe that I convinced her with my arguments regarding it,
How do
sir.
you enter AIMS Bhopal and all? The same AIMS exam is taken. AIMS is a separate exam, now NEET is there.
Sir, when I gave the exam in 2014, sir, there was a separate exam for AIMS. Now, sir, there is a common entrance exam for all the colleges, which is now known as NEET UG, sir. So all the government colleges, all the AIMS are now get the admission through that exam, sir.
So only the toppers will get into AIMS Delhi and all?
Yes, sir. So it's on the rank basis, sir.
Rank basis.
Yes, sir.
Madam.
You have, you were just talking about the new research and all that.
Yes, ma'am.
Now, what are the different methods of research that are employed for medical research? Methodology, there must be some methodology.
Ma'am, I'm not sure about the in drug research, ma'am. In drug research, ma'am, we have different methods of trials. We have randomized control trials that we do. We have case control theory. We have case cohort theory by which we do research in medicals, epidemiological research, ma'am. Other than that, ma'am, the recent advancements in the artificial intelligence sector has also created a new segment where we are artificially testing the viability of new drugs. Ma'am,
So some blind research system?
ma'am, these actually form part of the trials that the case studies that I was telling you, ma'am. Randomized control trials, and so blinding is done to remove bias from these studies, ma'am. So multiple kinds of blinding, ma'am. Single blinding, double blinding, depending on the only the experimenter unaware of the project, or the parts are persons are unaware about the project.
All right. Okay. Now, medically, has any research been done that allopathy combined with something else? I mean, no, there are Ayurvedic, other systems.
Yes.
So, has any research been done on that? Which is better types?
Ma'am, I'm not aware of the research specifically linking these two, but in the recent COVID pandemic, we have also seen, along with the allopathy, there were guidelines that for holistic immunity building, we were using products like Giloy, also to give a comprehensive protection from the disease. Also, ma'am, after the formation of the National Medical Commission, there has been talks of giving some limited license to the Ayurvedic Ayush doctors as well, ma'am, so that even they can prescribe some drugs, some allopathic drugs as well. So there has been some government initiatives to bring bridge between these two branches, ma'am, but I am not aware about the research that has been done.
Are you aware that it's quite some time back, but a spiritual leader joined with the scientists for an experiment on brain waves.
Ma'am, as far as I remember, I have read something about the effect of meditation on brain waves and how it affects the electroencephalogram waves of a person who is meditating and who is not
This
meditating.
experiment was done by who? There's a book
Ma'am, I'm not
quite
sure.
a few years back. Actually, Dalai Lama was involved in that.
Ma'am, I'll look into it, ma'am.
Just GK. Now, you have not worked as a doctor.
Yes, ma'am.
So then, how will you help people? If supposing you are posted in a district and there are some medical, obviously there is a hospital there, a new hospital. Some machines are there, but they have not been installed, and patients need that. And there are certain other emergencies, health emergencies.
Yes, ma'am.
So how will you deal with the situation?
Ma'am,
As an administrator, you will have to do something about it.
yes, ma'am. So, ma'am, this contains two-part action from my side, ma'am. First would be considering the emergency of the treatment required by the patient. If the treatment required is of emergent nature, I would try to refer the patient to a higher institute or the nearby institute which can provide the necessary treatment, ma'am. Secondly, I would work to identify the causes behind why the machines were not installed in the first place and would try to speed up the process of the installation, ma'am.
But if in this situation,
Yes,
I'll
ma'am.
make it more complicated for you,
Yes, ma'am.
that the nearest hospital is pretty far and the patient is not in a physical condition to be safely transferred there.
Yes, ma'am.
Then what?
Ma'am,
By road. Obviously, normally this is done by road only.
yes, ma'am. If possible, I would try to airlift the patient if I can arrange for that, or else I would try to bring in a team of doctors, which is actually done in many cases, where the specialized doctors, a team is created and the team of doctors visit the place instead of patient visiting the patient visiting the doctor, ma'am. So I would try to create an conducive environment for the doctors who can perform the procedure or the
And if your local doctor
Yes, ma'am.
is you find not very competent,
Yes, ma'am.
since you have the knowledge,
Yes, ma'am.
so then what will you do?
Ma'am, if I am sure about the incompetency of the local doctor, or if I have some evidence regarding him, I can report him to the Chief Medical and Health Officer of the district, and he could take the necessary action, or if he wants to suspend the doctor or transfer the doctor or try for the training of the doctor, he can do it, ma'am.
Okay, now tell me, you are saying that you want to go from medicine to administration
Yes, ma'am.
so that you can reach more people.
Yes, ma'am.
But as per your order of preference,
Yes, ma'am.
first is IAS,
Yes, ma'am.
but second and third are, you know very well what they are.
Yes, ma'am.
Customs and income tax.
Yes, ma'am.
How are you going to help the patients in customs and income tax?
Ma'am, the first thing that any hospital needs is money, ma'am.
So what?
If the taxation is done, if the taxation policies are applied well, if the tax collection is done in a nice way, we could ensure more money more money can be spent on healthcare sector, which can be then further improved now.
You are taxing the private health institutes
Yes, ma'am.
like your Max and whatnot. You
Yes,
know?
ma'am.
So you are taxing them. So how are you helping them? And they will only try to make money.
Yes, ma'am.
So how are you helping them? Do you know,
Yes, ma'am.
I mean, do you think that if the money is being collected from a hospital
Yes,
as
ma'am.
tax, will it go directly to a government hospital?
No, ma'am, it won't go directly to a government
Why?
hospital, ma'am.
What is the system?
Ma'am, the collected money first go to the central government, and then the central government, depending on the distribution, will allocate the money to different sectors, ma'am,
As per the budget.
as per the budget, ma'am. Yes, ma'am.
So, how does that help? And as a taxman, you are only taking tax.
Yes, ma'am.
You are not responsible on the other side.
Yes, ma'am. Ma'am, the
What I am trying to
Yes,
tell
ma'am.
you is that your argument should be consistent at least.
yes, ma'am.
Here, when you are saying from medicine, I am going to administration so that I can help more people in as my doctor's training tells me,
Yes, ma'am.
then your choice here betrays something else.
Yes, ma'am.
There is more power in, you also know, that is why you are saying IAS. I am surprised you have not put IPS, you put IPS as fourth.
Yes, ma'am.
है ना? But IAS, income tax, customs, there is a lot of power. You have seen, obviously you know that.
Yes, ma'am.
Even police has as much power, but anyway.
Yes, ma'am.
So your choice is on that, not on this. है ना?
Yes, ma'am.
तो कुछ देख लेना, there should be consistency in your answers.
Yes, ma'am.
है ना? अच्छा, do you, what can you do about the women's condition in, say, a place where maternal death rate is very high? If you are posted in a district where the maternal and child mortality rate are very high,
Yes, ma'am.
what will you do?
Yes, ma'am. Ma'am, the first part that comes in case of improving the maternal health indicators is ensuring that the women of my district have at least 4 antenatal visits as recommended by the government. Also, ma'am, I would try to.
How will you ensure that?
Ma'am, there are new maternal and child health cards which are given to the women, and with the help of the ASHAs and the A&M workers, they are motivated, they are inspired to go to the hospital, visit the nearest hospital at particular times.
Fine. Okay. Next point.
Next point would be, ma'am, to increase the institutional delivery rate in the hospital, ma'am. There are many schemes like Janani Suraksha Yojana which incentivizes hospital delivery. I would ensure that the target
Yes,
woman
okay.
is.
Now you are talking about only the hospitalization related.
Yes, ma'am.
But are there any other factors?
Ma'am, general nutritional status of the woman has to be catered to. Also, ma'am, it should be noted that the woman is the physical activity of the woman during that period is also not too much that harms the woman.
Now these are the factors.
Yes, ma'am.
How will you ensure that improvement in that?
Ma'am,
By telling the women it is of no use.
yes, ma'am. Ma'am, we have government schemes like Pradhan Mantri Matru Vandana Yojana, which during the period of pregnancy gives financial incentives to the women. So we can ensure that they get those financial incentives.
They may
and not-
get the financial help, but that help might be used by their husbands in drinking.
Yes, ma'am.
Then,
Ma'am, there has to be a.
matlab there has to
Definitely,
be
ma'am.
something to stop that, na? To ensure that it goes for the right purpose.
Yes, ma'am. Ma'am, we can have grievance redressal
Grievance
mechanisms.
redressal क्या होगी? वो husband पीटता हो, पीटेगा उसको प्रेगनेंसी में, क्या करोगे तुम?
Yes, ma'am.
Chaliye.
So anyways,
No medical
Pandit ji.
question, please.
Okay.
Non-medical.
बहुत हो गए.
You have been asking medical.
Okay.
Testimonial.
Let's see. अच्छा मुझे ये चीज़ बताओ कि how you can supply the मतलब increase the supply of doctors. How what government is doing to increase the supply of doctors?
Sir, with regard to new government programs, sir, the government is planning to increase, planning to structure a new medical college in every district, so that we can increase the number of government seats in the hospitals. More and more number of graduates will eventually lead to more number of doctors in the society, sir.
Okay, and what is the number of medical colleges, do you remember, in India at present?
Sir, I am aware about the new aims. There are total of 22 aims that are planned, sir. But
Overall medical colleges?
overall, sir, I am not
Not,
sure.
okay, so about 700, okay. Now, I wanted to ask you that what was the life expectancy at birth during independence? I mean, at the time of independence, or say even in 20th century, and how it has improved, and do you see the role of medicine in that?
Yes, sir. Sir, I'm not sure the exact data, but I suppose it was in the range of 40s during the time of independence. Presently in India, the life expectancy is around 69 years. So we can correlate that to the advent, like you said, to the advent of new medicinal technologies and new drugs that have come to ensure that the diseases are cured at the right time before they become fatal, sir.
Like one of the success of modern healthcare or medicine is in control of communicable disease. But when it comes to non-communicable disease, it is found that modern medicines are not that effective. What
Yes,
do you
sir.
say about that?
Sir, in cases of non-communicable diseases, sir, the modern medicine basically plays the role of controlling the disease, not curing them, sir. So if we take the example of hypertension, diabetes, we have a lot of medicines which only prevent the complications to happen, but can't cure the disease. The cure part lies in the preventive medicine, that is lifestyle modifications and promoting healthy habits amongst the individuals. So that is
It is also said that medicines have done lot of harm to the society. Modern, especially allopathic medicine. What do you say about that?
So there are definitely some side effects related to certain medications, especially if we talk about higher levels of antibiotics, anti-cancer medications. They have some side effects associated with them, sir. But they also, on the other hand, treat the major part of the disease, sir. So we can't, in my opinion, we can't neglect that positive part as well, sir.
One of the problem which general citizens face, whereas their health expenses are concerned, there is a lot of out-of-pocket expenses. So how do you? What can be done to reduce out-of-pocket expenses on medical bills?
Yes, sir. So firstly, the reason for a large percentage of out-of-pocket expenditure is the insurance penetration in India is very low as compared to developed nations, sir. So government has brought in Pradhan Mantri Jan Arogya Yojana to provide medical insurance to people, sir. On the medicine part, sir, the government has also initiated the Pradhan Mantri Jan Aushadhi Pariyojana, sir, for supply of generic medicines to the people. So by providing insurance cover as well as controlling the prices which the private hospitals charge sometimes, and providing the medicine drugs at a lower cost, we can improve the out-of-pocket expenditure, sir.
And what is the difference between generic medicine and branded generic?
So generic medicine is a medicine whose the brand has brand name is a medicine which has the same equivalency, chemical equivalency as that of a branded drug, just that its brand name has expired. So it has been the other manufacturers are also in the field are allowed to manufacture that drug, not only the original pharma company that was producing it. So the branded generic, I'm not aware about the branded generics, sir.
Like Rosin is and paracetamol. Tell me which is what crocin is a generic or branded generic?
Sir, crocin is a branded name, sir. Paracetamol with the core component of acetaminophen is the generic form, sir.
Okay. So coming back to your hobby,
Yes, sir.
like you like coffee brain, can you tell some of the positive, benefits of drinking coffee? What are the negative effects of coffee?
Yes, sir. So the positive effects of coffee drinking includes, sir, firstly, it is known to boost metabolism, which helps in fat burning and weight loss, sir. Secondly, sir, it is known to increase alertness and focus. Thirdly, sir, there has been some research regarding the role of coffee in reducing the incidence of Alzheimer's and Parkinson's disease, sir. Also, sir, the coffee is a neurostimulant, sir. So it helps to boost like performance during exercises, sir. Coming to the negative parts of drinking coffee, sir, the coffee regular caffeine withdrawal has known cases of increasing gastric reflux in people. Also, sir, in cases where people suffer from insomnia and anxiety, coffee generally increases their anxiety levels. And
Okay, tell me what is the role of polyphenols and how can you get polyphenols? Have you heard about polyphenols?
sir, I have heard there are components of the beverages like tea and coffee, sir.
So do you think polyphenols are good or bad for health?
Sir, I am not sure about it.
Okay, that's fine. Yes.
I think that's fair enough. You have been asked. We'll give you the feedback also now itself.
Yes, sir.
This will be your first interview.
Yes, sir.
First time you are going to
Sure.
UPSC.
Yes, sir.
Obviously, being a doctor, there will be flooding of questions on medicine. The entire medical landscape of India you should be aware of, and definitely your reasons for going into medicine, IAS was not very convincing. Don't say individual and all that. You can say that. You just say that being a doctor also one can serve. But I think once I become a part of the policy making under the government, the canvas becomes larger.
Yes, sir.
Because if you say individual, I get posted and do this and that, you will be.
Not only that, he has put IAS as first and both the revenue services as second and third. Customs and income tax.
That also shows that you are willing to take even a non-medical profession. Second is revenue, third is customs.
That's
so
right.
You won't be able to take it. I caught you, so they can also catch you.
Yes, sir.
So just make it a very, very safe answer.
Make it an honest answer.
Actually, it is better to be honest.
You say
Because
that-
otherwise you get into these issues.
Yes, ma'am.
You are very well aware. When I kept asking you, you realized it.
Yes, ma'am. Yes, ma'am.
है ना? So be honest.
Yes, ma'am.
Whatever the reason.
You
okay.
say that somehow civil services attracts you, because of diversity or because of larger, arena of public policy and going to, contribute towards so many other areas. So I find that this has attraction for me.
I'll get wider opportunities to contribute to various sectors, maybe including health also. Like
Yes,
that
sir.
you said, sir.
That will be best.
Including maybe health also. I'll get an opportunity. So that's why I'm excited. But this medical is also a very noble profession. My mother herself is a doctor. So I know how noble the profession is. Defend this also.
Yes, sir.
You should know what is the expenditure of state governments or Madhya Pradesh government or central government. What percentage of GDP is spent on and how it should
Recent
be
doctor
increased.
ratio. Recent doctor ratio. What is WHO recommendation?
Yes, sir.
This, that,
And like this year budget also, or maybe last year budget, and a lot of medical colleges they are opening at district level, which
Yes, sir.
and curative, preventive rather than dietary guidelines.
Lifestyle diseases
Lifestyle.
in India and why India is diabetes capital, what can be done? This kind of general questions.
General questions. And polyphenols, they are good for, tea has polyphenol, coffee has anything which has a color, and plant based. So read more, when is your interview?
So it's not been.
So you have a lot of time.
You have a lot of time.
Read about blue zones, longevity, nutrition. How nutrition is becoming very important. It's becoming part of the medicine. Earlier it was not, So have a broad picture, of health, lifespan.
Longevity research.
Longevity research, a lot of things. Many members, they are old, they may be reading, they may ask you,
Blue zone you should know.
it is nothing to do with C. It is the zones which are where people live longer, maybe centenarian. So, I mean, some general things, about health
Lifestyle.
policy.
It is basically lifestyle.
Yes, ma'am.
So, general awareness you keep around health, Ayushman Bharat, what is, and those kind of issues.
But that doesn't mean you should not read the other things.
Current affairs
Current affairs तो जरूर पढ़ते रहना.
जनरली पढ़ते
तो
रहो.
वहां से क्या पूछेंगे तुमको पता नहीं है, पर एटलीस्ट हेल्थ में क्या पूछेंगे यू कैन गेस.
अगर तुम हमस में कुछ कम भी जानते हो तो माफ कर देंगे कि डॉक्टर हो कितना तुम हमस के स्पेशलिस्ट बनो.
हाँ, कितना जानते.
लेकिन मेडिसिन में नहीं जानते हो तो माफ नहीं करेगा.
Yes.
दैट्स योर कोर एरिया.
Yes.
समझ गए. ऐसे ही होता है. I cannot expect that you are a super expert of West Asian affairs and Israel Hamas war. कुछ जानते हो मुझे पेपर में पढ़ते हो. I'll be happy with that.
Yes.
Unless you are a student of political science, international relations,
Yes, sir.
that is your specialization, then I will not excuse you. Otherwise, I'll think why will he know so much about that? So उसमें कोई दिक्कत नहीं होगी.
Yes, sir.
Medical science should be very. You can make your case on the basis of your medical answers, medical related answers before
sir.
the board. Yes, this boy knows his subject very well.
Yes, sir.
He knows the health issues of India very well.
We read about dietary allowance also. What is the recommended dietary allowance?
Yes, sir.
How much protein, what is the deficiency, different type of,
पता होगा.
उस तरह का.
Nutrition is a problem in child stunting and breasting, fasting जो भी आता है सब का एक बार सब कोई एक लिस्ट बना लो ना कैसे
Yes,
पढ़ोगे
sir.
चिल्ड्रन हेल्थ विमेंस हेल्थ ओल्ड एज के लोगों का हेल्थ इशू क्या है
जेरियाट्रिक जो क्या है
सब
साइंस.
एक लिस्टिंग कर लो सारा.
हेल्थ से रिलेटेड जितने भी मतलब वर्टिकल्स हैं, न्यूट्रिशन हुआ, प्रिवेंटिव हुआ, क्यूरेटिव हुआ, डिफरेंट मेडिसिन आयुष से लेके सीधा अल्टरनेटिव मेडिसिन, उस तरह का देख लो.
हेल्थ में अगर अच्छा करोगे तो तुम्हारा बहुत अच्छा नंबर आ जाएगा.
मतलब
They will think that he is the right health administrator of future. They will realize this. ठीक है. और तुम्हें कुछ पूछना है?
No, sir.
You are a good candidate. You will do well. Okay.
That's it.
All the best to you. You can go now.
Thank you, sir. Thank
All
you.
the best.
Thank you, sir.
Done for the day.